Hi, welcome to our event here today about obesity and type 2 diabetes. We welcome you and we hope that you find this very useful in your journey as you're personally trying to figure out what you need to do with this topic. So first of all, I want to actually start out by thanking our sponsor, Novo Nordisk. Now, this type of event can't happen without Novo Nordisk, and we really thank them for being the sponsor of this program. So my name is Lonny Stormo. I spent 30 years at Medtronic prior to founding a company in diabetes called POPS. And I also live with type 1 diabetes. So this topic is very close to me, and I'm glad that the ADA asked me to be part of this event. I want to start out by giving you some overview of obesity and type 2 diabetes, and then we're going to go into a panelist conversation, and you're going to hear a lot of great ideas about how things that you can do to manage your obesity and type 2 diabetes, or help people on that journey. And then you're going to see some awesome resources from Molly around how ADA is providing you things to help you out. So let's start out with just some facts about obesity and type 2 diabetes. First of all, I think we all know that this is a really common and serious problem. Unfortunately, it's too common. In the US, the prevalence, or how much it's existing, is 42% of the population has diabetes as of the last date we have good statistics in 2018. That's a huge number, and unfortunately, it's been growing too. So we have, in 1999, 30% of the population with diabetes, and now 42% of the population with diabetes. That's almost 1% per year. And when you look at the most severe part of it, the people that are very severe obese, that's more than double in that same time frame. So what's the big deal? Unfortunately, obesity-related conditions also come with very many symptoms of that, or consequences of that: heart disease, stroke, type 2 diabetes, and even certain types of cancer. And these are leading causes of preventable but yet premature death. So this is why we care so much about this, and it drives up the costs in our system too. So the annual estimated cost of diabetes in 2008 was $147 billion. Your personal medical costs for a person with obesity is $1,429 higher than a person without obesity. And so in this way, this is affecting you personally as well as it's affecting our general economy. Now, if we start to look at kind of how does that spread across our population, you can see that non-Hispanic Black adults, Hispanic adults, and non-Hispanic white adults all are kind of in that same 40-ish range. 40% of them have obesity. Non-Hispanic Asian adults are doing much better, and probably a lot to do with their genes, and we'll talk more about that in a minute, at 17%. When you look across the age spectrum, there's actually not that much difference. When you look from 20 to 39, or 40 to 59, or above 60, you're all talking about kind of 40 to 45% of the population has diabetes. Where we do start to see some more variation is across the country. So you can see in the southern states and then up into the Iron Belt, we have 35 to 40% of the population has has obesity. And then you see kind of the spread across the country and see some variation in different states you're in, including some really low spots that only have 20 to 25% in places like Colorado and Massachusetts. So there's a lot of factors going on here, and I'll talk about that in a minute, and we'll talk about that more with our panelists also. Let me first talk, though, more about type 2 diabetes. So we've been talking about obesity, and type 2 diabetes is one of the consequences of obesity, but let's now talk about type 2 specifically. It is the most common form of diabetes, and it means that your body just isn't using insulin properly. So some people control their blood sugar levels by eating better, some by exercising, some need medication and even insulin to manage this. It kind of varies across the spectrum of people with type 2 diabetes. Now, if you look at the total US, about 10% of us, about 34 million Americans have diabetes. And almost 90 to 95% of those are type 2 diabetes. So this is by far the most prevalent version of diabetes that we have in the US here. And most often that develops in people age 45 and above. So we talked about the consequences of the outcome of obesity. There's also consequences and outcomes of diabetes, and maybe not just diabetes, but uncontrolled diabetes. If you can't bring that back into control, the kinds of things you start dealing with are heart disease, kidney failure, stroke, blindness, amputation, some really scary words. Unfortunately, that's what we're experiencing with this condition if you can't control that diabetes. So it's really important to start thinking about, okay, so what can I do to control this? Unfortunately, there's not a one size fits all. It's going to vary, as I mentioned earlier. But we do know that a huge part of managing type 2 diabetes is eating healthy and also fitness. Now, that's true of all of us. Even if you don't have type 2 diabetes, we should be eating healthy and have that fitness. But it's especially true here if we want to try to avoid those types of consequences I mentioned earlier. So sometimes it takes a long time for this to develop, and you might not even know you have it. I know when I found out that I have diabetes, I didn't know anything about it until my eyesight started to change. And my eye doctor said, you need to go to the emergency room. I think you have diabetes. And so that was a complete surprise to me. And unfortunately, too many people are walking around with type 2 diabetes and uncontrolled type 2 diabetes until something bad happens. And so this is why it's important for you to talk to your doctor about this. Make sure you're getting the screenings or even do the ADA risk test for diabetes, because it also has an economic impact on you. The annual healthcare cost for a person with diabetes is over 2 times a person without diabetes. So that's a big economic factor right on you also. So what I love about what we're doing in healthcare right now is breaking down these kinds of things more to the root cause, so we can start to try to figure out how can we address those causes. And here's 3 things that I want to talk about. So social determinants of health. If you don't know the term social determinants of health, I urge you to look it up, find out more about it. But basically what it means is there's things around you as an individual that are affecting your health. How well you are off economically, whether you can get access to healthcare easily and the right type of healthcare, whether you can get the right type of food. Sometimes you talk about food deserts and people aren't in a place where they can get nutritious food, so they're forced to eat unhealthy. These are social determinants of health. So those are important things you to be aware of and not be a victim of, but start to address them. How can I do something about that? Biological factors, it's a little bit harder to do something about your biological factors, right? We're all going to age. And you know, the genetics that are handed down to us, or our ethnicity or race that are handed to us, are something that we just probably don't have much effect over. But lifestyle factors are one we absolutely have effect over. How we're eating, whether we're being active, and those kinds of things. So starting to kind of break down the causes of diabetes and obesity into these primary factors and then things we can do something about is a really important element for us all to take charge of our condition. So I've been a volunteer with the American Diabetes Association for a number of years, partly because I have diabetes, but partly because I love the mission of what ADA is all about. And it's really these 3 things: to cure diabetes, to prevent diabetes, and to improve the lives of those with diabetes. And so it's with these 3 things that we really can go start to make a difference for us, the people living with diabetes. And I really appreciate that the American Diabetes Association is focused on that and helping us out, including events like this one here today. So with that backdrop on obesity and diabetes, let's bring in our panelists here for a really interesting conversation about resources and other things that you can do to help manage your obesity and diabetes. And let me start by asking the panelists to each introduce themselves. Sheila, can you go ahead, please?
Hi, yes, thank you for your presentation and the information, great information around diabetes. I'm Sheila Harmon, advanced practice nurse, certified diabetes care and education specialist with the University of Illinois. I have been an educator since 2005, and I have type 2 diabetes.
Thank you, Sheila. And Robin?
I'm Robin Nwankwo, retired diabetes educator, dietitian from the University of Michigan, and I've been a volunteer with the American Diabetes Association since 1995.
Wonderful. And Thad?
Thanks, Lonny. I am a living proof of the statistics that you pointed out earlier. I was diagnosed with diabetes around the age of 45. I'm currently 47 years old. I was an active adult before, so it was a bit of a shock that I was diagnosed as a type 2 diabetic. And since that I was diagnosed, I wanted to volunteer my time with the ADA to get other people with diabetes a chance to become more active.
Wonderful, Pat, and thank you for volunteering as well as the others. And Deborah.
Hi, everybody. I'm Deborah Young-Hyman. I'm a behavioral health psychologist. I also am, we used to call it a CDE and have been for decades, and was one of the first psychologists to obtain that certification. My role in all of this is to help people to live more successfully with diabetes, and among many years of volunteering, I am currently on the professional practice committee of the ADA.
Wonderful. Thank you, Deborah. Let's start out with you, Deborah. Can you tell us the difference or tell us more about the link between obesity and type 2 diabetes?
Sure. So we know that obesity is a very high risk factor for the development of type 2 diabetes, weight-related diabetes, although all people with obesity do not develop type 2. And we know that there are multiple 100 gene alleles that make people more susceptible to becoming obese. And then there are also social determinants of health, as you mentioned earlier, Lonny, as well as the genetic and biologic predeterminants. I don't know, and I don't want to misspeak, I don't know what the particular weightings are of the gene alleles for developing type 2 diabetes, but what we do know unequivocally is that the heavier a person is, the more likely they are to develop type 2.
So Deborah just talked about the linkage of weight and type 2 diabetes. And so clearly managing our weight and eating has a lot to do with that is an important thing. So Robin, can you tell us a little bit more about what the term mindful eating means?
To be mindful means to be aware of your sensations, your the surroundings, to be present in that experience. And when you apply that concept to eating, then that means that you have an established set of parameters or rules, new rules to go by. And that would mean no distractions while you're eating, no judgment of the foods and the choices that are in front of you, no dieting thought, because you're really wanting to experience what that food is doing with you and for you. It's meaning that you're considering the crunch, you're thinking about the texture, the taste, or flavor. You're paying attention to the sensations of the food within your mouth, and you're able to verbally describe, take some moments to tell yourself what you were experiencing. That's mindful eating.
Yeah, that seems like a really important point. We're just not eating for the point of eating. And we're moving into the holiday season, and sometimes it can feel like you're just around food all the time. So how can mindful eating be a tool for us during the holiday season?
Mindful eating means, if you think about the ME, that means that you're focusing on you or me. And when you're focusing on what you're eating, why, generally with the holidays, you've got all of these foods that have all kinds of memories attached to it. And you want that ambiance, and you're seeking that same experience from your yesteryear time. But with mindful eating, you're actually looking at, so what are the flavors that I'm tasting, and is it matching what I originally had? There is an example that I'd like to share of a gentleman who had his mom's cake in memory. And whenever he saw that cake made, he always felt like he had to eat large portions of it, no matter what. When we talked about the guidance of using mindful eating, about being aware of the textures and the flavors, and he started using his ability to judge or make an assessment, not a judgment, on, was that even close to what his mom made? did it taste the same? It really didn't taste the same. He wasn't getting the enjoyment out of it that he thought, and he found that he was able to corral his ability to corral how much he ate and change his ability of needing to eat all of it to just really saying, I don't need to eat this because it's not the same thing.
Yeah, that's a wonderful story about that, and I think a really important one. So Sheila, let me bring you into this conversation. So what lifestyle changes can be implemented to decrease obesity?
Yeah, so as Robin said, learning how to eat healthy and being physically active, trying to get in that 150 minutes of exercise a week, meaning, 30 minutes a day, at least for 5 days a week. And so being able to really focus on what type of physical activity do I need to do. When we say exercise, people don't want to exercise. An example was I had a patient who I told her during the holidays, in some families, we like to dance. We like to have these dance off, old school versus new school. The young ones think they can outdance the older ones. Us older ones think that our dances were better than what the younger ones are doing. So what I told her was during the holidays after dinner, say, hey, let's start dancing and playing some music. And I told her to play it for 30 minutes and pay attention. And after the 30 minutes to start clapping and applauding and telling her family, thank you for helping me exercise. And so when she came back, she said she had did that. And she said her family was like, what do you mean help you exercise? We didn't help you exercise. And she was like, yes, we just danced for 30 minutes. And so that was a way of showing her family that they actually did some physical activity together for 30 minutes by dancing. And they didn't even realize that they were engaging in physical activity. They were just dancing and having fun. And that's what it's about, having your family be able to support you when you are trying to, best manage your diabetes, which also the physical activity helped to decrease your weight. And that's all, important with families being able to have that support.
So Tad, that's a great place to bring you in. So, she was just talking about family and how important that is, so how important is the support of friends and family members in diabetes management?
Sheila's absolutely right. It's really good to have a very good support system. Having a family member or a friend there during an activity makes the time go so much faster. You don't even realize you're actually doing the activity and you're enjoying it all at the same time. And it increases your mental health and your hunger. One of the things having a support system does is maybe your friend or family member will split a meal with you. It makes the portions that you eat smaller as well. So not only does it help with activity, it does help with healthy eating as well.
Yeah, that's a great tip, the split meals. I do that all the time. So when you are trying to control your diabetes, what are some of the indicators that your diabetes is uncontrolled versus controlled?
I'm gonna be honest here. I've gone through it twice. Uncontrolled fatigue is a huge factor. You start feeling like you don't want to do anything. Your head's cloudy. You become irritable, short-tempered, and it affects your life. It is hard when you're uncontrolled to tell a diabetic, let's go exercise or let's eat healthy when your blood sugar and your body's just not functioning the way it should be. And that's where also it's important to have a support system where other people are noticing maybe you're not acting like yourself or you're more irritable. So when you are controlled with a plan from a doctor, taking your medication, doing the activity and healthy eating, you feel better, you're healthier, you're in a better mood, you're not as irritable, and people will notice a change in you along with your health. I mean, it's tremendous having that plan and using your support system and taking your medication, because I hear a lot of diabetics just do not want to take their medication because they think they can do it on their own. And it's a battle. I've done it twice. I've done well. I've slipped back and I've had to do it again. So I know all the symptoms. So that's how it is.
Yeah, it's a great point. I mean, it's a lifestyle change. Like we're talking about lifestyle changes. And Sheila, you talked about lifestyle changes. Do you recommend or suggest apps as one resource for people that are trying to make lifestyle changes?
I usually, when I'm working with my patients with diabetes, I usually take them to like the ADA website to show them that there are things that are there. I kind of ask them, you know, what are they interested in? What have they tried? Because there are so many different apps. So I don't have one in particular. I heard, I think, I don't know if it was Deborah or Robin used it before about the Create Your Plate, being able to create your plate, being able to create their plate. If they want to do physical activity, it depends on like what type of activity are they into, because there are just so many different apps. So I tell them to just like look, see what fits them that they want to do. But the main thing is that I want them to find something they're going to stick with, something that they're going to do. And so I don't want them picking something because it's what I tell them I do or I share what I do. Because for me, I work best as far as physical activity when I'm doing it with my family or either on the cable networks. They have different channels that do like walking videos, different things. And so that's what I try to get them to do, to kind of do some research to see what's out there that'll fit what they're interested in doing.
Yeah, I think that's a really key point, and I can just share one piece of data. We published this data. We had over 400 people answer the question, you know, do you want an app, use an app to manage your diabetes? And over 90% of them said, yes, I do want to use an app, but only 10% of them were actually doing it. And when you kind of dig into that, it's kind of what you were just saying, Sheila. They really weren't finding apps that work for them in whatever their particular lifestyle is, and something they're going to stick with and actually use. So yeah, there's a lot of resources out there, but you got to find the right one. So once you do that, Sheila, you know, how do the lifestyle changes really start to affect the diabetes?
And so what we know is with physical activity, it helps you be able to lose weight. It helps you to be able to maintain your weight. With healthier eating, you know, when patients come and they say, well, I want you to give me the diet. There is no diet, right? We kind of don't use that word diet. What we say is healthy eating because it's a lifestyle change. And so what we want people to do is to be mindful. I love that word, Robin, mindful eating. And what we want them to do is to be able to say, let me plan my meals. So when I'm teaching my patients, I say, let's talk about what are carbohydrates. These are the foods that are going to raise the blood sugar. These are the foods we're going to have in moderation. And so when we look at the My Plate model and I have them putting together their meals, and then when they're able to do it themselves, I don't know what they have at home. But what I want to do is encourage them when they're going to shop and buy groceries to be mindful about the things that they are going to be buying, right? Like I might tell them, if you go to Aldi's, if you know anything about Aldi's, all the snacks are in the front of the store. So I told them, get that basket and run straight to the bag. Once you get to the bag, you have passed all the snacks. And you know, we teach you don't go shopping when you're hungry because you're gonna buy things that you don't want. So I try to go to different stores in the communities to learn the layout of the stores so that when I'm working with my patients, I'm able to say, if you shop at Food for Less, if you shop at Save-A-Lot, if you shop at Aldi's, if you shop at Jewel, or you know, whatever stores I see in the communities, because depending on where patients live, they're food deserts. And we find that. And so I have gone to the local corner stores in the communities to encourage them to have more fresh produce for the people in the communities who can't get to a larger grocery chain. And so with that, it's like when you are able to be healthier in your eating choices, it's a lifestyle change. If you're able to be physically active, getting in 150 minutes minimum of exercise, it decreases your weight, it helps you maintain your weight, and that helps you better control your diabetes.
So that gives me a segue, a really wonderful segue for all these wonderful changes and suggestions that are physical activity and nutrition. People are suggesting, feed that back to your healthcare providers. They're part of the team, and you need to make sure everybody's on the same page with your efforts and the changes you might need in your medical regimen. Because we know when you lose weight, you may need less medication. We know when you're on medication and you exercise, you might be hypoglycemic. You can get hypoglycemic if you're using insulin and you're a person with type 2 diabetes. So I think it's really important with our team members on this call to realize we're all part of the same team, but we need to coordinate information, and that the center of that coordination is the person who has diabetes or obesity. Because if you are on your way and you have insulin resistance already, then it's time to make all these changes, and it's time to get with your doctor and try to get in front of it. That, I guess you didn't have any warning signs before you were diagnosed?
No, I was actually a very active adult, and I actually increased my activity the year before. I was running half marathons, and I just kept getting slower and slower. And you would think that as much activity I was doing, I'd be getting faster. So I actually went and got a heart check, thinking that there was something wrong with my heart before I got my blood test to show that I was diabetic.
Wow. Yeah, it's interesting, and I can relate to that because I also am a runner, and one of my early symptoms that I ignored was I was getting cramps all the time when I was running, and once I figured out I had diabetes and started controlling it, all of a sudden I didn't get cramps anymore. So, Thad, you talk about activity. How do you feel on a sedentary day, or one of your lazy days, if I could put it in layman's terms, versus kind of more of your active days? Just how do you feel physically?
I have a job where I have to sit for a long period of time, and you just, again, you feel lethargic. You just don't feel, your head feels cloudy. You just don't feel good overall, and it's amazing. And when we say get active, it doesn't have to be go out and run a marathon or run a 5K. It can be simply just get up and go walk around the building once an hour or around the block, and you get the blood flowing. You feel better. And when you feel better, you're gonna make better food choices. So it's amazing. I have a step goal with my Garmin watch of 10,000 steps a day, and I try to maintain that every day, just as a way to motivate me to get up and walk. So it's just a world of difference if you just make a small change of going for a short walk, take your dog, take your friend, go for a chat outside, and just do that.
And do you feel like when you exercise that has a lasting effect on how easy it is to control your blood sugar? I mean, there's kind of a carryover beyond the activity.
There's a huge carryover. When you track your blood sugar, interestingly enough, when you're doing an activity, your blood sugar increases and it shows real high while you're running and stressing your body. But after that, your blood sugar does even out and is lower the next day when you monitor it. So it helps tremendously.
Yeah, great. So as we're getting towards the end of our time here, Robin, so again, we're going into this holiday period. What are the best choices for me as a person with diabetes during the holidays? Oh, you're muted, Robin.
The message of what is the best fit for you. It is just making a choice and a decision as to what is going to be your best you and what will support you in doing that, including food choices. So I talked to several people, they feel that holiday seasons are going to be this notorious time of feasting, etc. I ask people to stop and think about themselves or the me, so mindful eating, ME, and then make some decisions on, so if this food is so yum, so full of goodness, why is it good? And is it good for me? And literally go through that process with all of their favorite foods, so almost like a practice session, or make a decision. That already said, smaller portions. That could be, I'm gonna have everything that I want, but I'm gonna have smaller portions this time. That is the small step to take. And as people make those choices, they discover so many more opportunities that they have of choice and control, if they like to use that word. And it gives them more strength and as Sheila talked about, empowered. They feel empowered.
Yeah, absolutely. So Deborah, just kind of tagging on to you on that question as talk about family support and so forth. How do we help our families change behavior around helping us manage our diabetes?
Well, that's a great question. It's also pretty complex. You may be a person, the only person in your family who has diabetes, or you may be in a family where multiple members have diabetes. And we know that the more people who participate in joining you in your positive, healthy decision-making, the easier it really is. It's something that's been brought up before. You mentioned it, Lonny. Are you supposed to eat that? Should you have that cake? And one of the key aspects about that is not shaming people for the choices they make over time, but try to have a dialogue with your family members and with people in your community, your faith community, your physical activity community. As Thad said earlier, how can we help support me in better decision making? And we know that makes it easier. And frankly, it's about a healthy lifestyle ultimately, because we're asking people who have been diagnosed with diabetes or are obese to lead a healthy lifestyle, which is what we're asking of everyone. So normalizing rather than making it some horrible condition, I think, is a core.
Yeah, I love the way you finished that. I agree with that. It shouldn't have to be that you're a big exception to the party. It's just part of kind of what we're doing. And Robin, you wanted to say something more about low carb foods?
As a starter experiment, people could try a lower carb, making a decision or a choice to say, this year, I'm only going to have so many of the carbohydrate choices that's going to fit on a quarter of my plate. Carbs meaning grains and the starchy vegetables like the sweet potatoes or the rice or the stuffing, etc. And making that as a starter point, and then having everything else being options to use on that create your plate tool will be a way to experiment in the ability of, how much ability do I have to make these choices? Or, wow, look at what I did. I never would have been able to just eat that much, but I made the decision before going into the meal to have a smaller amount.
Perfect. And I think that's where we'll end. That's a great way to end. Thank you, panelists. Appreciate so much everybody's kind of great insights, and hopefully everybody here had a chance to benefit from these things. And so now I want to introduce Molly Duerr to come on and finish out our program.
Hi, I'm Molly Duerr. I'm the Director of Revenue Development and Operations for ADA. And what I'm going to do today is to share with you some of the free resources that the American Diabetes Association has. So the first resource that I want to share is our Diabetes Food Hub. You'll see up here at the top of the page that I am logged in. You're able to make a free account. And what you're able to do with this is to actually take and save recipes that you find on this site, as well as to use it to create a meal plan. So as you can see here, ADA, we have over 1,000 of recipes that are available on our Diabetes Food Hub. You can see when you go in, we really want to make sure that it's quick and easy for people to know what the serving size is, as well as the calories and the carbs. You can see that there's social. People have given it thumbs up and down. And then you also have this star here so you can save the recipes. When I go into the recipe again, we've got the nutrition label here. We want to make sure that it's very clear, easy to find the nutrition information. As I scroll down on the site, you'll see the ingredients and the directions, just like you would expect. But one of the newer features for Diabetes Food Hub is the shop ingredients. If you click the shop ingredients button, it will actually allow you to put in your zip code, and you're able to find a retailer in your area that you're able to take and actually put those ingredients into a cart and check out and pick it up with that retailer. If you're interested, up here, you're able to browse all of the recipes that we have on Diabetes Food Hub. You can filter. So say you needed a kidney-friendly diet and you wanted it to be a main dish item. You're able to filter and it will pull up all of the recipes that are available on Diabetes Food Hub that have that information. You're also able to put ingredients in. So if you like chicken but you don't like broccoli, you're able to put that in, and again, it will filter the recipes. Under the My Recipe section here, this shows all of the recipes that I have liked, that I put a star on. And the next thing that you're able to do is under meal plans, you're actually able to take and build a meal plan, a weekly meal plan from all of the saved recipes that you have. So again, this is why you want to log in and create that free account. So I will very quickly do a drag and drop and just demo how this works to create a meal plan. We'll just do one day here. Again, I'm just quickly pulling things that would be able to go into a meal plan. You can look here then at the nutrition facts. So you can see I'm well under calories, 770. But you're able to get that nutrition fact information, and you're able to pull over other recipes. There are side dishes also that you're able to pull over and use as well. And then the last tab up here, you're able to use to create a grocery list. So say you didn't want to do shop ingredients and you wanted it to generate the grocery list. By generating the grocery list, you're able to go through, you can edit it, and you can say, you know what, I need a larger quantity of the lean beef for the stew. Or you can also remove items altogether from your shopping list. And then from here, you're able to email it to yourself, download it, print it. The nice thing is with an account, again, a free account, you're able to also pull this up as you're in the grocery store and going through the aisles to select and remove the items as you put them into your cart. So the next feature or the next resource that I want to be able to share with you is our diabetes risk test. I know that we had a number of panelists who had shared about the diabetes prevention program. And so I want to take this opportunity to share with you our diabetes risk test. The diabetes risk test is 7 questions that someone can answer to find out if they're at risk for type 2 diabetes. It's very quick. It is available in English as well as Spanish, and you're able to take it for yourself or for someone else. I'm going to go ahead and take it for someone else right now. So the questions that you're going to answer, if you click the I, it gives you additional information as to why this is calculated into your risk and why it's so important. All of the questions that you're going to be answering are going to be questions that you would know the answer to. So questions like if you have a family history of diabetes, if you've been diagnosed with high blood pressure before, if you're physically active, race and ethnicity plays a factor into diabetes risk as well. And so when you get to this screen, you're able to either choose to email it to yourself or to go ahead and view the results. If you email it to yourself, it's really nice because you're able to have it on hand to share with your provider. And if you want to view the results, there's also the opportunity here to email yourself the score as well. So you'll see here in the profile that I completed, this is someone who came up at high risk for type 2 diabetes, so scored 7 out of 10. And in this section, you're able to answer if you've been diagnosed with diabetes or if you've been told that you have prediabetes. If you answer the question that you've been diagnosed with type 2 diabetes, it will connect you with our recognized program. So this is diabetes education. And you're able to put in your miles as well as your zip code in order to be able to pull up all of the diabetes education programs in your area. ADA, we feel that's really important to connect people with diabetes education. If you answer this question, that you've been told that you have prediabetes, you're able to, from here, select to find a diabetes prevention program. And with the diabetes prevention program, it will pull up the list of the programs that are closest to you in person, as well as the online programs that are available as well. And as others had mentioned, the diabetes risk test and being connected with the diabetes prevention program is something that is really important. We know for people who go through a diabetes prevention program, there's a 58% chance to delay or prevent the onset of type 2 diabetes through making those moderate lifestyle changes. For those who choose to email yourself the score, again, really important to discuss your result with your provider. ADA, we do follow up with emails, so if you're in the high risk category, again, the importance of following up with your provider. If you're in the low risk category, again, we're emailing resources and information to be able to reinforce why you're in the low risk category and what lifestyle changes to continue to make to stay low risk. If you scroll down in the diabetes risk test, you'll also find that there are different resources that are available here as well for people if you're in the high risk or the low risk category. Of course, the way that you can take the diabetes risk test is off of ADA's homepage, off of diabetes.org, or you can go to diabetes.org/risk-test and take the risk test as well. So you'll see here on this screen that I'm on our diabetes.org website. And if you scroll down, you'll find this section called Community Connection. And this is one of the newest tools from the American Diabetes Association. And again, you can put in your zip code wherever you live in the country. And what it'll do is it will pull up all of the resources in your area to be able to help you live well with diabetes. So if you're having an issue around food and you need to receive emergency food, and you'll see the zip code that I put in is for Boston. There are over 3,000 programs in Boston to help people to live well. And this shows you what resources are available for emergency food. It also shows you the eligibility criteria. And then you're also able to contact the organization that has that listing. This community connection, there are many different languages that are available. And you're also able to, if you wanted to search under health or you have transportation issues, that you're actually able to come in and to get connected with those specific resources. If you had a need, so example, and you wanted diabetes education, you're able to pull up all of the free programs for diabetes education. You'll see many of them are offered by the American Diabetes Association, but then there are other programs that you're able to get connected with. Again, some programs in here are free, some of them have a fee, but there is the eligibility criteria that you're able to look at. So again, this resource is something that anybody is able to come to our diabetes.org website and use. We also have a lot of healthcare providers that are able to use it to refer their patients, again, to free resources within their community. Another resource is to call our Center for Information, which is 1-800-DIABETES, and they can also help you to navigate any of these resources. So Lonnie, from here, I will hand it back over to you.
Perfect. Thank you so much, Molly. Those are fantastic resources for us all to be aware of, right there. And thank you for what ADA is doing and bringing those resources. I want to thank again our 4 panelists and the great conversation we had. Hopefully they gave you a lot of ideas and thoughts in terms of how you can deal with your obesity and diabetes journey that you're on. And I especially want to thank our sponsor, Novo Nordisk. Without Novo Nordisk, these kind of things and activities and resources that we're bringing to people just wouldn't be possible. So thank you, Novo Nordisk.